discuss together about the situation in Europe, in Italy and Europe. So it's a tough task to give an overview of what's going on in Europe and then in particular in Italy. Because the highlight of the session, so the aim of the session is to highlight the current status of teledermatology, different places around the world, how it's currently being used and working. So, and my task was Europe. Well, tough task because, as you of course know, Europe is made by many countries. 27 of them, they form the European Union. And we are speaking about 5.6% of the world population. However, you will find diverse scenarios, country from country, and within the same country, the scenarios are completely different. And still, we don't have regulations so we have regulations from the European Union, but national regulations are still prominent over the European Union disposition. So the situation, it's complex, and you can find a summary of all possible scenarios. You will have beautiful Alps. This is an image of Styria, Austria, where teledermatology is mainly used because of a remote area that you have. Or you can have scenarios like the one that we have in Naples. So we have public ambulatories crowded by patients, especially for chronic skin conditions. Look at what they say. Naples, the new polyclinic, the waiting rooms feel like an infernal cycles. Waiting times impossible to predict. So this is the situation. Or in general, as was already mentioned this morning, Europe is experiencing a shortage of doctors. So medical desertification, or desertification médicale, as the French named this. So, but by the way, European Union policymakers have made a lot of efforts in order to increase and facilitate telemedicine adoption. So we're not speaking just about teledermatology, but telemedicine in general. This is true, and this is also a pre-action study. This is a study that you can find on the webpage of the European Union, a market study on telemedicine in general in Europe. So look, it started before the pandemic, so 2015, and they analyzed how is the impact. So how is the market? And we are speaking about billion euros. So it's increasing a lot, the market of telemedicine, telehealth in Europe. Telecardiology, telepulmonology, teleendocrinology are the three medical specialties that account for the most of the telemedicine solutions, followed by teledermatology. So we are in the first row in teledermatology for the market. So, and this study also analyzed which were the barriers for adopting telemedicine solutions. And the barriers are, of course, cultural resistance, resistance by care providers, privacy issues. Always privacy issues are important, but also inadequate funding. So there was also some suggestions by this study on how to deal with the problems of improving telemedicine. And in fact, now we are in the era of the so-called e-Act of the European Union. So an effort with a series of funding to promote the digitalization of medicine. So digitalizing medicine, and also improving and promoting networking, and also a more globalized and interactivity between the countries that form the European Union. But the different countries are different in terms, speaking now about teledermatology and dermatology. This is a survey about the dermatologists in Europe. How many, so the number of dermatologists that we have in each country. And if you look, we are in Italy, we are a lot. So 70 dermatologists per 1 million inhabitants. In many countries, there are a lot of dermatologists. Spain, the Netherlands, and the UK are at the end of this spectrum. They have fewer dermatologists. At least this was the numbers. These were the numbers which I was able to find. These are not fresh numbers, but 2013, it's not so far away in time. But not surprisingly, speaking about teledermatology, Spain, the Netherlands, and the UK are leading countries in Europe because they have a need for it. So let's just give a look at some experiences. Since 2006, teledermatology has been extensively included, integrated in the Dutch healthcare system. It's fully reimbursed. By 2014, over 100,000 teledermatology consultations were conducted annually, so reflecting widespread acceptance among healthcare providers and patients. A similar situation in remote areas, but in many areas in Spain, we have soaring forward teledermatology significantly seems to increase the access and shorten waiting times in many publications and many experiences come from Spain in Europe. Just a little focus on France. Just an image. Did you know that in France there's a wide access, even if they have many dermatologists, they have a shortage of GPs and they have a shortage of other medical specialties, and they're using a lot these telecabins. Did you know it? So it's a kind of boxes that you find close to pharmacies. Usually you are helped by a nurse and you can have a medical examination sometimes in some of these cabins, including also dermatological examination. This is very, very popular among people and it's a big market, at least in France. One futuristic approach is this one from UK, interesting in my view, because this one is integrating AI in the teledermatology. So they're doing a lot of teledermatology. In this case, this study is speaking about teledermoscopy, and they compared the outcomes of if a clinician compared to a system called ALA-MD built on convolutional neural network in the evaluation of images, teledermoscopic images sent for triage. In the end, comparing AI versus standard of care for teledermoscopic triage of skin cancers with quite a number of images, so 867 lesions assessed by consultant dermatologists and the system ALA-MD. And ALA, so this was a non-inferiority studies, and ALA-MD had a significantly higher rate of identifying lesions that did not need biopsy or urgent referral. So it seems to work well, and we'll see if they will apply in clinical practice, because this is just a study for the moment. Then, okay, what about Italy? I told you in Italy we are so many, so teledermatology didn't grow really. A switch was made in the last years, a switch was made with COVID. Many of the dermatologists started telederm with COVID-19 pandemic. So it's an experience common to many of us in many parts of the world, but here in Italy, a lot of doctors started during the pandemic. And also because now we are getting benefit of the so-called recovery fund, so funding from the European Union after the pandemic. We have a lot of money, and the Italian Ministry of Health has to administer a total investment of 1 billion euros, 1,000 euros, and for the investment in telemedicine. But the idea here is telemedicine for the better care of chronic patients, chronic conditions. Again, so Italy, okay, we have Europe, which is a mosaic of countries, but also Italy. In Italy, we have 21 different regions in which each region governs, which regions leads its own system, medical system. But by the way, this was the difference, 282 before, 369 after the pandemic, experiences of teledermatology, dermatology of telemedicine, sorry, in total, dermatology, 3% of the experiences, but a lot of differences from one region to the other one. So still in Italy, more differences in the governance of medicine in general and also of teledermatology. So each region acts differently from the other one. By the way, in increase, and just to conclude, what we do in our clinic nowadays, we are just doing a lot of telemonitoring, especially for patients with chronic inflammatory conditions, so they don't have to come each time to maybe to renew their biological treatment, for example, or patients with also with acne. And we do a lot of telemedical consultation. This is an example of how we are dealing with our melanoma units in our clinic. So we meet with the other specialists once per week, every week, and we discuss every week about 50 to 20 patients in a remote telemedical consultation. So these are the two main ways in which we do telemedicine and teledermatology in our clinic. So challenges and future perspectives. Of course, we have to keep in mind that medical practices respond to a specific need usually. And so, of course, teledermatology will most probably continue to evolve differently in different countries, in each country addressing the specific need of that territory. A wide variability exists in European countries in teledermatology practice, but the interest is high. The technology is evolving fast. Funding are conspicuous. So if you have a project to present to the European Union, the funding are there. So challenges are always the same, mainly privacy issues and cultural resistance. And of course, for the dermatology community, we have to always stay updated. And thank you so much for your attention. And I renovate my invitation to Naples next year. Thank you so much.